Dr. Shuhong Zhu, who's with the University of California in San Diego, published a randomized clinical trial that showed that Quitlines were effective for reaching smokers and also for successfully helping them to quit. And there were a number of things he researched in that clinical trial. First of all, it was the approach, the counseling approach that was used with smokers. And what they found was that having a directed conversation and discussion with people about their quitting, their history of smoking, any quitting attempts, and what their triggers were, what their motivations were, really helped the person to be more successful. The second piece was the timing of those calls. And what they found was it was really important to have more calls early on when somebody was more likely to relapse than later on. And so this protocol really was research-based and evidence-based and became a foundation for all of the Quitlines that were developed across the U.S. And other countries as well. So that clinical trial was 1992. That year, California launched the first statewide Quitline in the United States. By the mid-90s, there were 4 Quitlines. Oregon, Arizona, and Massachusetts also launched them. And then it wasn't until the late 1990s, 1998, 9, and 2000, when really we saw a really fast adoption of Quitlines across all of the states. And as you'll remember, that's when the master settlement money became available to states, and many of them put some of that money into developing Quitlines because they had seen that it was an effective way to reach and help smokers quit. In 2004 and again in 2008, the Clinical Practice Guideline on Treating Tobacco Use was published. Steve mentioned that, Dr. Steve Schroeder mentioned that over his last 2 calls, along with the Guide to Clinical and Preventive Services and the Community Guide. And together, those really create an evidence base of how Quitlines work, how they work in public health settings, and also how they can be used as an adjunct in clinical settings. Next slide, please. So currently we have 53 state and territorial Quitlines. All 50 states, DC, Puerto Rico, and Guam have Quitlines. As I mentioned, these are funded by state as well as federal dollars. Some of the states are still drawing down on master settlement agreement money and using that to fund their state Quitlines. There also are 12 different organizations, call centers, that operate the 53 state Quitlines. And I put a link to a map here. And if you go to, not to a map, but to a report here, and if you go to that report, what you'll see is a list of the service providers who operate the Quitlines and which states they provide service to. So that's there if that would be helpful for you to see. Each year, Quitlines receive about 1 million calls for the 53 Quitlines, and they actually enroll over 300,000 tobacco users in treatment each and every year. So as an organization, a Quitline really has pretty extensive reach to smokers. Next slide, please. I wanted to share a few of the benchmarks with you because these are important benchmarks to the Quitline community. As I mentioned, Quitlines enroll about 300,000 tobacco users in treatment each year. And we call that treatment reach. That's the proportion of smokers in the U.S. who either get counseling or counseling and medication from a Quitline each year. You can see we also measure the reach to different priority populations: American Indians and Alaska Natives, African Americans, Asians, Latinos, and those with less than a high school education. We measure quit rate at 7 months after a person enrolls in treatment. And overall, Quitlines get a quit rate of about 30%, which we think is pretty good because over a third of our callers are Medicaid recipients and have a multitude of economic as well as other health issues. And we think it's great that over 30% of them quit with our treatment. We also measure, we've just started measuring quit rate for conventional tobacco, cigarettes as well as ends. And that question wasn't asked in fiscal year 16, so it's not presented here. The last metric I wanted to share with you is spending per smoker. As I mentioned, state Quitlines are funded mostly by state health agencies, and they invest about $2 per smoker in Quitline services every year. Next slide. So here's the types of services that Quitlines offer. Phone counseling with trained tobacco treatment specialists, and FDA-approved cessation medications for eligible callers. Most of the medications provided through Quitlines are nicotine replacement therapy, so patch or gum or lozenge. In the past few years, we've started adding newer services, text messaging, as well as web and online services and information, and cessation apps are now being developed. Next slide. I wanted to show all of you the types of services that are offered by your state Quitline if you're working in this public housing project. And you can see in all 5 of the state Quitlines that are participating, counseling, medication, text messaging, and online information and or counseling is offered in all 5 of the states. Cessation apps are really just being tested in Quitline environments, and those are not available in the 5 states that are participating at this point. I did want to mention also that at the face-to-face meeting, Tasha gave out a fairly extensive description of the services from each Quitline. And so that really describes more in depth the kinds of services, counseling and medication especially, that's available through your state Quitline. If you didn't get that or don't have it, please feel free to reach out to me and Tasha, and we're happy to provide that to you. Next slide. So as I mentioned, the services vary a bit from state to state. And so if you ever have questions about the kinds of services that are available in your state or any other state, you can go to NAC's website and click on this URL. And we have a map that describes in depth all of the services that each state Quitline offers. And I wanted to show you one of these pages just so you could see how much good information is there. If you go to the next slide, Becky, great. I chose the state of South Carolina, and this is page 1 of a profile. There's one more page, and I'm going to show you both pages. But if you go back to the first one, I wanted you to see how it's laid out. So the top of this slide talks about really how to get in touch with the Quitline. You can see the hours of operation, the phone numbers, the languages that are supported by the Quitline, and also there's a button that if you want to enroll in online services, you can just click on that button and get linked to online services. One of the most important parts of the profile is the services offered piece, and you can see there the specific counseling, medications, and web-based services are listed out. So in South Carolina, they do brief counseling, multi-session counseling, single sessions, multi-session, and text message to cell phone, one-way kind of counseling. So really trying to make as much available to people as they can. And really that way we can be consumer focused and know that people have alternates for what kind of counseling they get. Just below the phone counseling is an important part. It talks about the content of the counseling session. And I know a lot of people wonder what happens when I call a Quitline. First of all, you're going to be connected with somebody who isn't judgmental. You're going to be connected with somebody who wants to help you quit. And what they're going to do is talk about your tobacco history, work with you if you want to set a quit date on setting that date and planning for that quit date. They're going to go through and develop a quit plan with you, talk to you about withdrawal symptoms from nicotine and what that means and how you can manage that. They're going to talk about relapse prevention, weight gain, use of cessation medications, which is really so key in being successful, and also stress management. And so those are all the components of counseling that they'll go through, talking with a person and really trying to understand how they can help that person be successful. On the right side of the screen, you can see cessation medications. In South Carolina, you can get patch, lozenge, or gum. Those are all nicotine replacement therapies. And excuse me, and then the web-based services are listed. If we can go to the next slide, Becky, that would be great. Thank you. Good, and so this slide shows the eligibility criteria both for counseling and to receive medication, and also the specialized materials that are available from the Quitline for different kinds of really demographic characteristics. The counseling, take a look at that. Everyone who calls the Quitline can get at least one single call session. Readiness to quit is important. Youth under 13 are not eligible. The uninsured Medicare, Medicaid get multiple calls, up to 5 sessions. Pregnant and postpartum women can get up to 10 sessions. To receive medication, South Carolina provides medication to uninsured, underinsured, and people who have Medicare. For pregnant and postpartum, medication is not, they are not eligible for medication. And for Medicaid participants, and this is important especially for the community health center folks, South Carolina doesn't provide medication to people with Medicaid. They ask them to get it from their providers. And so that's a place that the community health center can really coordinate and work with the state Quitline. Becky, if you would click one more time, I think there's an arrow that shows up under provider referral. So the provider referral program is available both to the public housing agencies and to the community health centers. And this lower section of the profile describes how you can refer somebody to the Quitline. You can do that by fax and by electronic medical record in South Carolina. The person to contact to set up that kind of a formal referral program is shown here. It's Dr. Katie Wynn, who's not on the phone with us today, but she's been on other calls, and I think everyone in South Carolina had a chance to meet her. And for the other states, you can go to this profile and see who it is that's the referral program contact. Next slide. At the last session, Dr. Schroeder went over the 5 A's, and I just wanted to focus in on assist. And if you click one more time, Becky, I think there's a little arrow that comes up. Thank you. So when the community health center clinicians are talking with smokers about quitting and going through the 5 A's, I did want to suggest that when you get to assist, you ask them, would they accept a referral for counseling to the Quitline and describe the Quitline services to them. And also, if they have insurance, to go ahead and see if you can write them a prescription for an FDA-approved cessation medication. You saw in South Carolina, they do have very good medication benefits, but in many states, they're only able to offer a 2-week supply of NRT, of patch or gum. And so to really help somebody with a quit attempt, it's good to have a full course of medication if that person can receive it through their healthcare benefits. So that's one thing we did want to ask the community health centers to be thinking about. Next slide. There are a number of resources that we thought might be useful for the community health centers and PHAs. First, we mentioned on the last session that there are provider education opportunities to learn more about the clinical guidelines, to practice cessation protocols and discussions with clients, and also to better understand billing and coding that's available to clinicians. I also wanted to mention the patient resource card that Smoking Cessation Leadership Center puts out called the Blue Card. It looks like a little credit card and can be handed out to people really by the public housing agencies as well as community health centers, just to get them thinking about making a quit attempt and maybe calling 800-QUIT now. I know Smoking Cessation Leadership Center makes those available. They're on the website, and if folks have a question about that, I know Steve and Catherine are both on the line and would be happy to talk to you about that. Next slide. And just before I speak about this slide, I did want to mention also that I just reviewed for the Centers for Disease Control's Office on Smoking and Health 5 new videos that they're going to be putting out in April. There are 2 1-minute videos, 1 3-minute and 1 5-minute video, and they talk about what is a quitline. And as soon as those videos are available to the public, we'll let you know, because they would be great videos to show at a meeting with a public housing agency, or to have running somewhere in a community health center on a loop. They really demystify quitlines, and I think show people that it really is a non-judgmental and helping resource if they want to quit. So I wanted to end just talking about how to refer people to Quitlines. Quitlines accept referrals in a number of ways. 100% of all Quitlines accept fax referral. So again, all you have to do is set up that referral with the Quitline for your state, and everyone can do a fax referral. Many of them also do email or online referral, where you can just email a referral to a secure website, and the Quitline will call back that person within 24 to 48 hours. And a growing number of Quitlines are also doing electronic referrals directly from the electronic medical record to the Quitline. And those referrals are done also in about half the states right now. If we go to the next slide, it shows the types of referral by the states that are participating in this initiative. And you can see that all of the states offer fax referral, 4 of them offer online referral, and again, 4 of them offer electronic referral. So if you're a community health center, you can look at fax or online referrals. If you're as well as e-referrals, and if you're a public housing agency, really fax or online are probably the 2 methods that are available to you. Next slide. Great. And if you have questions or need any help navigating the Quitline environment, please feel free to reach out to me or to Tasha Moses, the program manager for NAC for this project.